Let's talk together about tailbone pain, aka coccydynia, and how to fix tailbone pain right now, as well as how to prevent it in the future. Hello, I'm Dr. Grant Cooper from Princeton Spine and Joint Center, and this video is on the often overlooked but incredibly important topic of tailbone pain. First of all, tailbone pain is pain in the coccyx, which is the bone at the very bottom of your spine. The most common reasons that people develop tailbone pain is a bruise from a fall or other trauma, or else from a repetitive trauma such as prolonged sitting on a hard surface, bicycle riding, rowing, or anything else that involves leaning back and forth on a hard surface. Giving birth is another really common way, unfortunately, to injure your tailbone. During pregnancy, because of the hormonal changes that occur, the ligaments in the body stretch. Now, this ligament stretching can give the tailbone extra flexibility during childbirth, which is good, but sometimes there can be too much stretching in the surrounding muscles and ligaments, and the tailbone ends up getting too much strain. And on top of that, the ligaments and muscles can't support the tailbone as well at the correct angle, and this can all lead to a lot of pain in the tailbone and the surrounding soft tissues. Finally, in rare instances, when there's been no trauma, it's possible, but quite uncommon, that a cancer can be causing tailbone pain. If you have no trauma and you have a visible mass around your tailbone, then definitely get that looked at to rule out a tumor. Lots of times, particularly if there was a specific trauma such as a fall, the tailbone pain, like any other bruise, sprain, or strain, will slowly get better with time and go away. Other times, however, the tailbone pain just hangs around. Now, one of the problems with tailbone pain is that you're quite literally always sitting on it. So even if you have a trauma, it's sometimes hard for the tailbone to rest because, again, you're sitting on it all day long, and that can irritate it and make healing more difficult. The easiest way to help yourself heal from tailbone pain is to use a doughnut pillow or wedge-shaped cushion to take the pressure off of your tailbone when sitting. Ideally, use the pillow or cushion whenever you sit, but basically the more that you use it, the better, because it will allow your tailbone to rest and it will help it to heal. Now, I say it that way in part because I've had patients in the past who just refuse to use a cushion at work or at school or wherever they're sitting most. And instead of just talking to me about that, they just decide that they're just not going to use the cushion at all. But of course, this is a silly approach, right? If there are places or situations where you don't feel comfortable using the cushion, then of course that's fine. I mean, we all understand that, but that doesn't mean that you can't ever use the cushion or pillow. Maybe you don't use it at work, but you can still use it in the car or at home. Basically, the more that you use the cushion, the more that your tailbone has a chance to rest. Okay, you get it. Other good home remedies would include icing the tailbone for about 20 minutes, and you do that several times a day. Of course, make sure to wrap the ice in a cloth or use a bag of frozen peas, and basically just make sure you pay attention to your skin to be certain that you aren't breaking down the skin with the icing. But in general, ice is a great topical anti-inflammatory for a problem that's so close to the surface of the skin as tailbone pain is. Another great home treatment that's sometimes overlooked is to make sure you're having easy bowel movements. If you have tailbone pain and you're also constipated or having difficult bowel movements, then you already know that this irritates your tailbone a lot. Try taking a stool softener such as Coccyx to help you have softer and less irritating bowel movements. Also, pay attention to your diet. Make sure you're eating healthy and clean, and that means less processed foods, less sugar, more fiber, more fruits and vegetables. And get some exercise, even if it's just walking, which also helps you have regular and easy bowel movements. I just need to pause for a moment and make a request of you. If you're enjoying this content and if you're learning something useful, please go ahead and press the like button as it helps us with our YouTube algorithm. And also, please subscribe to our channel. Thank you. Topical non-steroidal anti-inflammatories are also a good thing to try if your tailbone pain symptoms are significant. A topical gel such as Volaran gel, which is basically like a topical Advil, is nice because there are less side effects to topical medications, and the anti-inflammatory ingredient in Voltaren gel or any other topical non-steroidal will actually get to the site of inflammation in the tailbone. If you take oral anti-inflammatories such as Advil or Aleve, the limitation is that very little of an oral medication will actually reach your tailbone. So mostly those oral medications should be used as pain medications if they're used at all. Instead, if you're trying to fix the underlying problem, then for tailbone pain, I would suggest that you stick mostly to ice and topical anti-inflammatories. Now, if symptoms are very severe, or if they aren't going away after a few weeks, then it may be time to see a doctor. A doctor may get an X-ray or a CT scan to rule out a dislocation or a fracture in the case of a trauma. I would just mention here that CT scans have a lot of radiation and X-rays have comparatively little radiation, so ideally you can avoid a CT scan and get an X-ray unless for some reason the CT scan seems necessary. If the doctor is concerned for a tumor, then the doctor might order an MRI or a bone scan. If very conservative care that includes the doughnut and the topical anti-inflammatories aren't working, there are good and effective medical interventions. The most common is going to be an injection. There are 3 main types of steroid injections for tailbone pain. One is a joint injection into the sacrococcygeal joint. Another, depending on the exact location of the pain, is a ligament injection around the surrounding sacrococcygeal ligaments. Often one of those 2 injections is very effective. If those aren't helpful, then a coccygeal nerve block can be used to reduce the pain and inflammation. Importantly, all of these injections should be done under image guidance, either X-ray guidance or ultrasound guidance depending on the injection and the approach. The days of your doctor taking his or her best guess with a blind injection based on pushing on the patient and injecting the most painful area blindly should be over in the 21st century. It's not that blind injections can't be effective, they absolutely can be. However, using image guidance will make the injections safer and more effective, so image guidance really should always be used. It's also important that if you do receive an injection for tailbone pain, it's a good idea to use a cushion when sitting for a couple of weeks after the injection in order to help the tailbone rest while the inflammation is taken away by the injection. Physical therapy is another therapy that can also be used. Mostly, physical therapy helps to stretch the surrounding muscles, works to strengthen the pelvic floor muscles, and also works to improve posture. Now, some physical therapists and also some osteopathic doctors and also some chiropractors will perform internal adjustments or manipulations for the tailbone where a finger or fingers is inserted into the rectum in order to manipulate the coccyx from the inside. This can be very effective as well, although it usually takes several visits. Surgery is almost never needed for simple tailbone pain. Even if there's a simple fracture, conservative care is the mainstay of treatment. In over 20 years of caring for patients, I've never needed to send a patient for a coccyx surgery, and I don't have any colleagues at Princeton Spine and Joint Center that have had to do that either. So in short, it's very rare to need a coccyx surgery. Now, with that said, if you had a patient who had severe pain that wasn't getting better despite all the conservative care, a surgeon can take out a part or all of the tailbone. The trouble with this surgery is that even when it's performed, sometimes patients continue to have pain after the surgery. The most difficult cases of coccyx pain tend to be when the pain is caused by repetitive small traumas, such as with a bicyclist or a rower in a boat. These cases tend to be more difficult because if you don't address the repetitive traumas that are causing the pain, then there's a tendency for the pain to recur again and again. Sometimes there's an easy fix depending on the activity. For example, one activity that can lead to tailbone pain is someone who starts a new workout program that involves a lot of sit-ups. The sit-ups irritate the tailbone in this case, usually because of bad form with the sit-ups themselves. The bad form is usually due to a lack of education about the correct form on the one hand and a weak core on the other. So in a situation like this, the core is first strengthened with other exercises, And then the person's sit-up form is corrected, and the problem is generally solved in this manner. But if you have a bicyclist who has great form, but the activity itself just happens to irritate that person's tailbone, then what do? The obvious fix would be to stop bicycling. But let's assume that the person doesn't want to do that because generally the person doesn't want to stop their activity, which is fair. So then what do? Well, of course, you first look at the person's form on the bicycle to see if that can be improved. You then also think about modifications that can be made to the equipment in order to unload the tailbone. How about a softer seat or a cutout for the tailbone? How about changing the height of the seat so you're sitting on it a little differently, for example? And finally, even though the offending activity may be bicycling or rowing a boat, consider using a doughnut cushion when you're not doing the offending activity. So, for example, use a doughnut in the car or at work or when you're watching television or YouTube at home. That is, even though the real underlying problem is in the boat or on the bike, to the extent that you aren't going to completely fix that part of the problem, it may be that if during the rest of that person's day the tailbone isn't stressed at all, then the repetitive stress on the tailbone in the boat or on the bike maybe won't be enough to cause the person a problem. Thank you very much for watching. Again, if you like this video, please remember to press the little like button, and please consider telling a friend and subscribing to our channel. And if you have any questions or comments about this topic, or if you have a request for future video topics, then please leave me a message in the comments section below. Thank you, and I wish you the best of health.